The normal reproductive years of the female are characterized by monthly rhythmic changes in the rate of secretion of female hormones and corresponding physiological changes in the ovaries and the other sexual organs. This rhythmic pattern is called female monthly sexual cycle, or less accurately, the menstrual cycle. The average duration of the cycle is 28 days. It may be short as 20 days or as long as 45 days in some women. The ovarian changes that occur during the sexual cycle depend completely on the gonadotropic hormones FSH and LH, which are secreted by the anterior pituitary gland. Both FSH and LH are small glycoproteins with molecular weight of about 30,000. Throughout the childhood, due to the absence of these hormones, the ovaries remain inactive. At the age of 9 to 12 years, the pituitary glands begin to secrete progressively more FSH and LH, which leads to onset of normal monthly sexual cycle beginning between the age of 11 to 15 years. This period changes is called the puberty, and the time of the first menstrual cycle is called menarche. Both FSH and LH stimulate their ovarian target cells by combining with highly specific FSH and LH receptors in the ovarian target cell's membrane. In turn, the activated receptors increases the cell's rate of secretion and usually the growth and proliferation of the cells as well. When a female child is born, each ovum is surrounded by a single layer of granulosa cells. The ovum with this granulosa cell sheath is called primordial follicles. These granulosa cells believed to provide nourishment for the ovum and to secrete an oocyte maturation inhibiting factor that keeps the ovum suspended in its primordial state. After puberty, when FSH and LH from the anterior pituitary gland begins to be secreted in the significant quantities, the ovaries begin to grow together with the sum of the follicles within them. The first stage of follicular growth is moderate enlargement of the ovum, which increases in diameter twofold to threefold. The stage is followed by growth of the additional layer of granulosa cells in some of the follicles. These follicles are known as primary follicles. During the first few days of each monthly cycle, the concentration of both FSH and LH secreted by the anterior pituitary increases slightly to moderately, with the increase in FSH slightly higher than the LH. FSH causes accelerated growth of 6 to 12 primary follicles each month. The initial effect is rapid proliferation of the granulosa cells, giving rise to some more layers to these cells. In addition, spindle cells derived from the ovary interstitium collect in several layers outside the granulosa cells, giving rise to a second mass of cells called theca. This means it increases layers of the granulosa cells via proliferation, as well as there is development of second mass of cells outside the granulosa cells, and these are derived from ovary interstitium. Theca is divided into two layers, the theca interna and the theca externa. Theca interna develop the ability to secrete additional steroid sex hormones like estrogen and progesterone, and the outer cell layer, the theca externa, develops into a highly vascular connective tissue capsule that becomes the capsule of the developing follicle. The early proliferative phase of growth lasts for a few days. After that, the mass of the granulosa cell secrete a follicular fluid which contains a high concentration of estrogen. Accumulation of this fluid causes an antrum to appear within the mass of the granulosa cell. The early growth of the primary follicle up to the antral stage is stimulated mainly by the FSH alone. After that, there is greatly accelerated growth occur, which leads to development of the larger follicle that is called the vesicular follicle. This accelerated growth is caused by the following mechanism. Estrogen is secreted into the follicle and causes the granulosa cells to form increasing number of the FSH receptor that makes the granulosa cells even more sensitive to FSH. The pituitary FSH and the estrogen combine to promote LH receptor on the original granulosa cells, thus allowing LH stimulation to occur in addition to FSH stimulation, creating an even more rapid increase in the follicular secretion. The increasing estrogen from the follicle plus the increasing LH from the anterior pituitary gland act together to cause proliferation of the follicular theta cells and increases their secretion as well. The ovum also enlarges in diameter another 3-fold to 4-fold, giving a total ovum diameter increases up to 10 folds, or a mass increases to 1000-fold. As the follicle enlarges, the ovum remains embedded in the mass of the granulosa cells located at one pole. After a week or more, but before the ovulation, one of the follicles begins to outgrow all of the others. The remaining 5 to 11 developing follicles involute. This process is called atresia. These follicles are said to become atretic. The exact mechanism is unclear, but it has been postulated that the large amount of estrogen from the most rapidly growing follicle act on the hypothalamus to depress further enhancement of FSH secretion by the anterior pituitary. This blocks further growth of the less well-developed follicles. Therefore, the largest follicle continues to grow because of its intrinsic positive feedback effect, while all other follicles stop growing and actually involute. The single follicle reaches a diameter of 1 to 1.5 cm at the time of ovulation. LH is necessary for final follicular growth and ovulation. Without this hormone, even when large quantities of FSH are available, follicles will not progress to the stage of ovulation. After 2 days before ovulation, the rate of secretion of LH by the anterior pituitary increases markedly, rising 6 to 10 folds and peaking about 16 hours before ovulation. FSH also increases about 2-fold to 3-fold. At the same time, FSH-LH act synergistically to cause rapid swelling of the follicle during the last few days. The LH also has a specific effect on the granulosa and theca cells, converting them mainly to progesterone secreting cells. Therefore, the rate of secretion of estrogen begins to fall about 1 day before ovulation, while increasing the amount of progesterone begin to be secreted. In a woman who has a normal 28 days female sexual cycle, ovulation occurs 14 days after the onset of the menstruation. The events which are necessary for the ovulation are: Number 1. The theca externa begins to release proteolytic enzyme from the lysosome, and these enzymes causes dissolution of the follicular capsular wall and consequent weakening of the wall, resulting in further swelling of the entire follicle and degeneration of the stigma. Shortly before ovulation, the protruding outer wall of the follicle swells rapidly, and a small area in the center of the follicular capsule, that is called the stigma, protrudes like a nipple. Simultaneously, there are rapid growth of the new blood vessels into the follicular wall, and at the same time, prostaglandins are secreted into the follicular tissues. In another 30 minutes or so, fluid begins to ooze from the follicle through the stigma, and about 2 minutes later, the stigma ruptures widely, allowing a more viscous fluid which has occupied the central portion of the follicle to evaginate outward. The viscous fluid carries with it the ovum, surrounded by a mass of several thousand small granulosa cells that are called corona radiata. These two effects causes plasma transduction into the follicle, which contributes to the follicular swelling. Finally, the combination of the follicular swelling and simultaneous degeneration of the stigma causes follicle rupture with discharge of the ovum. During the first few hours after expulsion of the ovum from the follicle, the remaining granulosa and the theca interna cells change rapidly into the lutein cells. They enlarge in diameter 2 or more times and becomes filled with lipid inclusions that give them a yellowish appearance. This process is called luteinization, and the total mass of the cell together is called corpus luteum. The granulosa cells in the corpus luteum develop extensive intracellular smooth endoplasmic reticula that form large amount of the female sex hormones progesterone and estrogen. The theca cells form mainly the androgens androstenedione and testosterone rather than female sex hormones. However, most of these hormones are also converted by enzyme aromatase in the granulosa cells into estrogen. The change of granulosa and the theca interna cell into lutein cells is dependent mainly on the LH secretion. In fact, this function gives LH its name, luteinizing for yellowing. The corpus luteum mainly grows to about the 1.5 cm in diameter, reaching this stage of development 7 to 8 days after ovulation. Then the corpus luteum begins to involute and eventually loses its secretory function and its yellowish lipid characteristics about 12 days after ovulation, becoming the corpus albicans. After that, corpus albicans is replaced by connective tissue. The corpus luteum is highly secretory organ, secreting large amounts of the both progesterone and estrogen. Once LH has acted on the granulosa and the theca cells to cause luteinization, the newly formed lutein cells seems to go through a sequence like proliferation, enlargement, secretion followed by degeneration. All these occur in about 12 days. Estrogen in particular and progesterone to a lesser extent secreted by the corpus luteum during the luteal phase of the ovulation cycle. These have a strong feedback effect on the anterior pituitary gland to maintain low secretory rate of the both FSH and the LH. In addition, lutein cells secrete small amount of the hormone called inhibin. This hormone inhibits FSH secretion by the anterior pituitary gland. Low concentration of the both FSH and the LH that leads to corpus luteum to degenerate completely, and this process called involution of the corpus luteum. Final involution normally occur at the end of the almost exactly 12 days of the corpus luteum life, which is around the 26th day of the normal female sexual cycle, 2 days before the menstruation begin. At this time, the sudden cessation of secretion of estrogen, progesterone and inhibin by the corpus luteum remove the feedback inhibition of the anterior pituitary gland. Begin the secretion of increased amount of the FSH and the LH again. FSH and LH initiate the growth of the new follicles, beginning of a new ovarian cycle.